Imagine a world with no hospitals, no anesthesia, no antibiotics, and no modern surgical tools. Yet in this ancient world, over 2,000 years ago, physicians attempted one of the most delicate and dangerous procedures imaginable, operating on the human eye. This is the real story of how Roman doctors confronted blindness, how they tried to restore vision, and how their methods helped shape early medical history. To understand what these doctors were doing, we have to go back to daily life in the Roman Empire. Blindness was everywhere. People lived in dusty cities, traveled on unpaved roads, worked in smoky kitchens, fought in battles, and rarely had access to clean water. Eye injuries, infections, and age-related cataracts were extremely common. When the lens of the eye turned cloudy, people gradually faded into darkness. A farmer could no longer tend his land. A craftsman could no longer see his tools. A child might struggle to read or walk without help. Blindness wasn't just a medical problem, it was an economic and social disaster. Roman physicians, however, were not ignorant. They studied anatomy carefully. They dissected animal eyes, observed wounds from gladiator fights, treated soldiers on the battlefield, and read Greek medical texts from earlier thinkers. Through this experience, they learned that cataracts were caused by a clouding of the lens, something physical, something that could potentially be moved or displaced. This led to one of the earliest known eye operations, couching. It was not modern cataract surgery. It did not remove the lens. Instead, the doctor used a long needle to push the cloudy lens out of the line of sight. It was incredibly risky, but for some patients, it was the only chance to regain even partial vision. Now imagine the scene, a small room in a Roman insula, maybe above a workshop or near a public bathhouse. The patient sits upright on a wooden chair while assistants hold his head still. There is no anesthesia except perhaps wine or herbal sedatives. The surgeon prepares a needle made of bronze or steel, sharpened with meticulous care. He positions it at the edge of the patient's eye, just where the white of the eye meets the iris. The patient tries not to blink. The room is quiet. With a steady hand, the surgeon pushes the needle through the outer layer of the eye. Painful, yes, but the needle must go deep enough to reach the clouded lens. If he goes too far, the eye could collapse. If he pushes at the wrong angle, the patient could lose all vision immediately. Using slow, controlled movements, he nudges the lens downward, out of the visual path. If things go well, the patient suddenly sees light again. A flash, a shape, a blurry outline. Not perfect vision, but better than total blindness. For some, this meant the difference between helplessness and independence. For others, the surgery failed, sometimes with devastating consequences. The procedure demanded extraordinary precision, especially in an era before sterile tools or modern medical training. Our best written source for this surgery comes from Aulus Cornelius Celsus, a Roman author who described the technique in his medical book De Medicina. He explained step by step how the surgeon should insert the needle, how to judge the right depth, and how to stabilize the eye. His writing is so detailed that even today, historians marvel at how clearly he understood the challenges of operating on such a delicate organ. Archaeology supports these texts. Excavations in places like Pompeii, Cologne, and military forts along the empire have uncovered small, finely crafted eye instruments, needles, hooks, and probes made with surprising precision. Some have grooves or slate curves designed specifically for manipulating soft tissues. They're not modern surgical tools, but compared to what most ancient cultures had at the time, they're remarkable. After surgery, Roman doctors relied on natural substances to prevent infection. Wine, vinegar, and herbal mixtures were commonly used because of their mild antiseptic properties. Patients were instructed to rest in dark rooms, avoid dust, and keep the eye covered. Infection was still a major risk, and many patients suffered complications. But some recovered, and ancient authors mention cases where individuals regained functional vision. One of the most interesting aspects of Roman medical practice is how much of it was shared across the empire. Soldiers wounded on the frontier might be treated by military doctors trained in the same techniques described in books copied in Rome or Alexandria. Merchants traveling across the Mediterranean carried medical knowledge from place to place. Greek physicians, who were highly respected in Roman society, brought their traditions and improved upon them. Medicine was not static, it was a living exchange of ideas. And yet the limitations were enormous. Couching did not fix the underlying problem. Without the lens, objects appeared blurry and unfocused. Some patients needed large magnifying glasses to read. Many eventually developed further complications. By modern standards, this surgery is crude, but by ancient standards, it was cutting-edge innovation, a bold attempt to give hope to those who had none. What Romans did not know is also important to understand. They did not understand bacteria. They did not understand sterile environments. They did not know how the retina converts light into vision, but they recognized that certain physical problems required physical solutions. And that willingness to intervene, to try a surgical technique instead of relying only on herbs or prayers, set Roman medicine apart from many societies of the time. As centuries passed, this knowledge did not disappear entirely, but it transformed. During the Middle Ages, Islamic physicians refined cataract surgery further, introducing new tools and improved methods. European medicine later rediscovered and advanced these ideas. Modern cataract surgery, with its tiny incisions and artificial lenses, is far removed from couching, yet the courage to operate on the eye can be traced back to these early attempts. What makes the Roman story extraordinary is not that their surgery was perfect, but that they attempted it at all. With limited tools and limited scientific understanding, they still tried to restore sight. They pushed the boundaries of what seemed possible. And they left behind both written evidence and physical tools that show us how carefully they approached this dangerous procedure. Picture again that tiny Roman clinic, a doctor holding a delicate needle, a patient sitting upright hoping for a miracle, assistants steadying his head, the tension in the room, the doctor breathing slowly as he begins the incision, the risk, the uncertainty, the fragile hope. It was a moment that blended courage, skill, and desperation. A moment that tells us not just about medicine, but about humanity, about our constant desire to fight darkness and reclaim the light. These early surgeries were far from perfect, but they represent an important chapter in the history of medical science. They show how ancient people confronted the same fears and challenges we face today, using the knowledge and tools they had. And they remind us the path to modern medicine was built step by step, through experimentation, observation, failure, and occasional success. Even today, when historians examine the Roman tools recovered from the ground, they are struck by their craftsmanship. The needles are sharp, symmetrical, balanced. The small hooks are forged with precision. These instruments tell us that Roman physicians took their work seriously. They were innovators in their own time, navigating a world without microscopes or sterilization, yet daring to attempt one of the most delicate procedures in human history. So, the next time you think of ancient Rome as a world of gladiators, emperors, and marble temples, remember also the quiet rooms where doctors tried to restore sight. Remember the courage of the patients who trusted them. Remember the skill and steady hands required to operate on the human eye with nothing but a needle and hope. This truly is the real story of Roman eye surgery, not a myth, not an exaggeration, but a testament to early medical ingenuity and a reminder that even 2,000 years ago, people were fighting blindness with knowledge, effort, and extraordinary bravery.